So if you want to know why someone is experiencing severe unexplained pelvic pain in their 30s, or maybe why they're dealing with chronic bladder issues, well, the very first thing you might want to do is actually ask them to bend their thumb backwards.
Right, which sounds like a bizarre diagnostic tool, but it's incredibly revealing.
It really is. Today, we're doing a deep dive into a massive stack of urogynecological research, specialized physical therapy guides, and genetic literature that proves a completely counterintuitive point.
A point that really changes how we look at human anatomy.
Exactly. Because that seemingly harmless flexibility, the ability to drop into a split effortlessly or turn your elbows inside out at a party, it's not just an isolated quirk.
Right, it's not just a party trick.
No, not at all. For a significant portion of the population, it's a systemic connective tissue blueprint. It's a fundamental difference in how the human body is manufactured at the cellular level.
And we're discovering that it silently dictates the health of parts of the body that, honestly, most people rarely discuss openly.
Which brings us to the mission of today's deep dive. We are answering one specific question. Can joint hypermobility affect pelvic support tissues?
And the short answer is absolutely yes.
We're going to unpack the hidden and vastly misunderstood connection between those stretchy joints and the pelvic floor. So whether you are investigating your own mysterious pelvic symptoms or you're just, fascinated by how the human body compensates for structural weakness, this is going to fundamentally change how you view your own core.
To trace that line from a flexible thumb to a dysfunctional pelvic floor, we really have to bypass the macroanatomy. We need to zoom all the way in to the microscopic level.
Okay, so we're talking about the literal building blocks of the body here.
Exactly. We have to examine collagen.
Okay, let's break that down for a second because, when I hear the word collagen, my brain immediately goes to, skincare commercials.
Oh, absolutely. Anti-aging creams and all that.
Yeah, anti-aging supplements. Sounds like something you buy in a powder to get rid of wrinkles.
Well, the beauty industry has definitely monopolized the term. But collagen is literally the scaffolding of your biology. It's the cellular glue that holds your connective tissues together.
So not just your skin.
Right, not just your skin. Your tendons, your ligaments, your blood vessels, and your internal organs.
Yeah.
In conditions like hypermobility spectrum disorder, or HSD, and hypermobile Ehlers-Danlos syndrome, which is known as HEDS.
Which we see mentioned a lot in these sources.
Yes, constantly. In those conditions, the body produces collagen that is structurally altered. The genetic instructions for building that scaffolding are basically written differently.
So if the blueprints are different, how does that altered scaffolding, physically change the environment inside the pelvis?
Well, the pelvic floor is incredibly complex.
Okay.
It isn't just a basic hammock of muscle like people think.
Right.
It relies heavily on a massive web of connective tissue. You've got structures in there like the uterosacral ligaments, the cardinal ligaments, and the endopelvic fascia.
And what's their main job?
Their primary job is to suspend the pelvic organs. So the bladder, the uterus, the rectum, it keeps them anchored in their proper anatomical positions against the constant, just unrelenting downward force of gravity.
And the pressure of your own internal organs pushing down.
Exactly.
Let's look at the actual mechanics of that because our sources get into some...
Right. Type I has a thick diameter. It provides hardness, stiffness, and incredible tensile strength. It's the heavy-duty structural support.
It's like the industrial-grade material.
Perfect way to describe it.
Mm-hmm.
But in the women with pelvic organ prolapse, the expression of that heavy-duty type I collagen dropped significantly.
How much are we talking?
The studies show a decrease ranging from 26% to nearly 42%, depending on the specific ligament they tested.
Wow. That is a massive structural loss.
It really is. But the body doesn't just leave a void. While the strong type I is dropping, there is a simultaneous overexpression of type 3 collagen.
And type 3 is different.
Very different. Type 3 has a much finer diameter. It's associated with tissue healing and organizational flexibility, not with bearing heavy loads.
Okay, wait. I want to make sure I'm visualizing this correctly. Let's unpack this with an analogy.
Sure.
It sounds like building a massive suspension bridge, but instead of using thick, braided steel cables for the main supports, the contractor swapped them out for a network of bungee cords.
That is incredibly accurate, actually.
Right, because the bridge might hold its shape for a little while when there's no traffic, but under constant gravity and just the stress of daily living, those bungee cords are going to stretch, and eventually the roadway is just going to give way.
That analogy translates perfectly to what researchers are seeing under electron microscopes. The ultrastructure of these hypermobile tissues shows clear signs of cellular chaos.
Chaos in what way?
Well, they look at the fibroblasts. Those are the specific cells responsible for manufacturing collagen. In these prolapse tissues, the fibroblasts have swollen mitochondria.
Okay, middle school biology kicking in here. Mitochondria are the powerhouses of the cell. So if they are swollen, does that mean they are essentially redlining, like an engine running too hot?
Precisely. They're exhausted. The cells are working in overdrive, trying to repair and stabilize a structure that just keeps stretching and failing under pressure.
Oh, wow.
And alongside the swollen mitochondria, the researchers see diffuse atrophy of the smooth muscles within the connective tissue.
So it's breaking down.
Yeah, the collagen fibers themselves are arranged in this disorganized, haphazard pattern rather than the neat parallel lines you would see in a healthy ligament.
So the tissue literally looks frail and overworked at a microscopic level.
It really does.
So the key takeaway for you listening is this. People with joint hypermobility are building their core pelvic support with these cellular bungee cords.
Yep.
And because their baseline scaffolding lacks that stiff type I tensile strength, they are highly susceptible to pelvic organ prolapse.
And the most shocking part of the research, honestly, is that they can experience this prolapse without any of the traditional risk factors.
Wait, really? Like without childbirth or aging?
Exactly. We see young, nulliparous women.
Meaning women who have never gone through pregnancy or childbirth.
Right. They're presenting in clinics with severe pelvic organ prolapse. Their connective tissue simply cannot fight the battle against gravity, even without the trauma of delivering a baby or the hormonal changes you'd see in advanced aging.
Okay, wait, let me stop you right there. If the collagen hammock is made of bungee cords and everything is too stretchy, my first thought is that the hypermobile person would just feel incredibly floppy and relaxed, like a rag doll.
It makes sense you'd think that.
Right. If the ligaments are that loose, how does that translate into the intense pelvic pain you mentioned earlier?
Well, that is the logical assumption. And it brings us to one of the strangest and frankly most painful mechanisms in the body. We call it the hypermobility paradox.
The hypermobility paradox.
Yes, hypermobility literally translates to loose, but these individuals almost always walk into physical therapy clinics with incredibly tight, hypertonic, spasming pelvic floors.
So the joints are loose, but the muscles are rigid. Why on earth does the body do that?
Because the nervous system is incredibly smart, and it prioritizes stability above all else.
Okay.
When the ligaments, the passive stabilizers of the pelvis, like the ones surrounding the sacroiliac joint, when they fail to hold the bones and organs securely, the nervous system panics.
It realizes things are unstable.
Exactly. It senses that the pelvis is structurally wobbly. So to prevent the whole system from collapsing, the brain forces the pelvic muscles to take over the job of the ligaments.
Oh, so it recruits these muscles to work overtime.
Right, maintaining a permanent, low-grade contraction.
It's using active muscle tissue to do a passive ligaments job.
Yes. The muscles essentially become a permanent, clenched fist trying to hold the pelvic joints and the internal organs together. And muscle tissue is simply not designed for constant 247 contraction.
I mean, imagine holding a heavy bag of groceries with your arm extended straight out in front of you.
Right, you can't do it for long.
You might be fine for a minute, but after an hour, your bicep is going to be screaming, shaking, and just completely locked up.
And that constant guarding leads to a cascade of painful issues inside the pelvis. The muscles become so hypertonic and fatigued that they develop myofascial trigger points.
Which causes that chronic, aching pelvic pain.
Exactly. And because these tight muscles wrap around the urethra and the base of the bladder, their constant clenching causes severe urinary urgency.
Oh, because the bladder is constantly being squeezed.
Right, making the brain think it needs to empty immediately. It also leads to painful intimacy, clinically known as dyspareunia, because the vaginal canal is surrounded by a muscle layer that just refuses to yield.
And I imagine it causes severe constipation too, right? Because a muscle that won't relax is a muscle that won't let anything out.
You hit the nail on the head.
Wait, I have to jump in here because this directly contradicts almost every piece of mainstream pelvic health advice I've ever heard.
Oh, absolutely does.
If someone complains about feeling pelvic heaviness or they mention that they, leak a little bit of urine when they sneeze, the classic advice from fitness magazines and honestly, even from a lot of general doctors is always, do your Kegels.
Just tighten it up.
Exactly. The prevailing wisdom is that leakage equals weakness, so you just need to tighten things up. But if a hypermobile person's muscles are already clenched into an exhausted fist, isn't doing hundreds of Kegels, like A terrible idea.
It is actively harmful.
Actively harmful.
Yes. Blanket advice to just do Kegels can severely exacerbate symptoms for a hypermobile individual. Their muscles are already fatigued from chronic overcontraction.
Right.
If you tell an exhausted clenched fist to clench even harder, it isn't going to get stronger. It's just going to spasm, fatigue completely, and ultimately fail.
Which actually worsens the leaking and the heaviness.
Exactly.
So what do they need to do instead if Kegels are out?
They require a process called down training. Down training is all about paradoxical relaxation.
Okay.
Before they could ever even think about building healthy, functional strength, they have to learn how to actively stop sending the clench signal. They have to convince their nervous system to lengthen and yield those pelvic floor muscles.
So this isn't about powering through weakness. It's about calming an overworked, panicked system.
Yes.
But this localized muscle guarding in the pelvis doesn't exist in a vacuum, does it? The sources show it triggers a massive systemic domino effect that ripples through the entire body.
The statistics from the hypermobile community paint a very stark picture of this systemic chaos. In a large-scale survey of women with hypermobile Ehlers-Danlos syndrome, 60% reported suffering from stress urinary incontinence.
60%? That's huge.
And 54% had urgency incontinence. Up to 88% experienced severe pelvic girdle pain during pregnancy, and 64% reported painful intimacy.
Wow. Those numbers are astronomically higher than what we see in the general population.
They really are, and it goes beyond just the mechanics of the skeletal muscles holding the joints together. The nervous system itself and the organs get dragged into this connective tissue chaos.
Right, which introduces a critical piece of the puzzle.
Yep.
Dysautonomia.
Yes, dysautonomia is highly prevalent in people with hypermobility, particularly a specific condition called postural orthostatic tachycardia syndrome, or POTS.
POTS.
Dysautonomia is a dysfunction of the autonomic nervous system. This is basically the background operating system of your body.
The stuff on autopilot.
Exactly. It controls all the automatic processes you never have to think about, like regulating your heart rate, managing your blood pressure, controlling your digestion, and operating your bladder reflexes.
So if the autonomic nervous system is the background software, how does faulty connective tissue hardware cause the software to crash?
Well, connective tissue makes up the walls of your blood vessels, your stomach, your intestines, and your bladder.
Right.
If those walls are made of stretchy type 3 collagen, they are overly compliant. For example, when a hypermobile person stands up, gravity pulls their blood downward. In a typical body, the blood vessels constrict to push the blood back up to the brain.
But in a hypermobile body.
The stretchy blood vessels just expand and let the blood pool in the legs.
Oh, no.
Yeah, so the autonomic nervous system panics, realizes the brain isn't getting enough oxygen, and spikes the heart rate to compensate.
Which explains the dizziness and the racing heart. So how does that affect the gut and the bladder then?
The stretchy walls of the intestines fail to create the proper peristaltic waves. Those are the muscular contractions that move food through the digestive tract.
So everything slows down.
Exactly. The gut motility becomes incredibly sluggish, leading to severe chronic constipation and painful bloating. At the same time, the sensory nerves in the stretchy bladder wall get confused.
So the bladder reflexes misfire.
Right. A patient might not feel the sensation of needing to pee until the bladder is dangerously full, or conversely, the nerves might misinterpret a tiny stretch as an emergency, causing desperate urgency when the bladder is mostly empty.
Here is where the patient experience becomes incredibly frustrating. I mean, think about living through this constellation of symptoms.
Right.
You have severe constipation, so you go to a gastroenterologist.
Right.
They run a colonoscopy, see that the colon is structurally intact, and tell you everything looks fine.
Yep.
Then you go to a urologist for the bladder leaks. They check the bladder lining, find no infection, and tell you it's normal.
It happens all the time.
Then you go to an orthopedist because your hips and lower back are in agonizing pain. They take an x-ray, the bones aren't broken, so they prescribe basic physical therapy. You're bouncing from specialist to specialist, and they are all running isolated tests on their specific organ of interest.
It is a profound failure of siloed medicine. Medical education trains doctors to look very closely at the bricks, but very few are trained to evaluate the mortar holding the whole house together.
Which is the connective tissue.
Exactly. Patients can spend decades navigating this fragmented system, often being dismissed and told their widespread, seemingly unrelated pain is just anxiety.
And to complicate things even further, actually getting a proper hypermobility diagnosis as an adult is notoriously difficult. Our sources mention doctors might try to use the Baton score, which is the standard diagnostic tool for hypermobility.
Right, the Baton score is a 9-point scale that measures joint laxity. A doctor will ask you to bend your thumbs down to touch your forearms, bend your pinky fingers back past 90 degrees, hyperextend your elbows and knees.
And place your palms flat on the floor without bending your knees. It's basically a checklist of those elementary school flexibility tricks.
It really is.
Yeah.
But the glaring flaw in the Baton score is that it fails to account for the body's natural aging and compensation mechanisms.
How so?
Well, as individuals age, tissues naturally undergo some stiffening. But more importantly, as we discussed with the hypermobility paradox, the adult nervous system has spent decades forcing the muscles to guard and clench tightly to hold the unstable skeleton together.
So the muscles become so locked up that the person actually appears physically stiff?
Exactly. An adult patient might walk into a rheumatologist's office, be asked to place their hands on the floor, and be completely unable to do it because their hamstrings and lower back are locked in a permanent spasm.
Oh, wow.
So the doctor marks a 0 on the Baton score and tells them they aren't hypermobile. They fail the flexibility test even though they have a severe underlying connective tissue disorder that's causing all of their pelvic and systemic symptoms.
Your body compensates so aggressively to keep your skeleton from falling apart that it literally masks the very condition causing the problem in the first place.
It's tragic, honestly.
It's a brilliant survival mechanism by the human body, but an absolute diagnostic nightmare for the patient trying to find answers.
We have outlined a very complex, challenging scenario here. Faulty collagen bungee cords cause the pelvic organs to sag. A panicked nervous system clenches the pelvic muscles into a painful, exhausted fist, and a fragmented medical system often completely misses the root cause.
So for you listening who is nodding along right now thinking, oh my gosh, this describes my entire life, we need to talk about solutions.
Right.
Because we can't go in and edit someone's genetic code, right? We can't fundamentally change the structure of the collagen itself. So how do we actually begin to fix this?
Well, while we can't change the hardware of the connective tissue, we can absolutely rewire the software of the nervous system and change how the muscles operate. And interestingly, the most effective entry point for fixing a dysfunctional pelvic floor actually starts all the way up at the breath.
Wait, how does breathing fix a prolapsed bladder or an exhausted, clenched pelvic floor?
It comes down to anatomical mechanics. Your respiratory diaphragm, that's the large umbrella-shaped muscle sitting right under your lungs, and your pelvic floor are intimately physically linked.
Link how?
They operate in tandem, like a piston inside an engine. When you take a deep inhale, your lungs expand and your diaphragm lowers into your abdominal cavity. To accommodate that downward pressure, your pelvic floor should naturally yield, lengthen, and drop down with it.
Okay, got it.
And then when you exhale, the diaphragm moves back up, and the pelvic floor gently recoils upward.
They move together, diaphragm drops, pelvic floor drops, diaphragm rises, pelvic floor rises.
In a healthy system, yes. But hypermobile individuals feel inherently unstable. Their nervous system lives in a chronic state of fight or flight, constantly anticipating that their joints might slip out of place.
Right, the panic we talked about.
Yeah, so to protect the spine, they unconsciously adopt a shallow, chest-breathing pattern. They become habitual breath holders. They're using the internal air pressure in their lungs to brace their core.
Because their ligaments won't stabilize their spine, they use lung pressure as an internal corset to hold themselves rigid.
Exactly. And that constant bracing destroys the natural piston mechanism. If the diaphragm never fully descends, the pelvic floor never gets the mechanical signal to lower and relax. It stays locked, high, and tight.
So how do you treat that?
Treatment requires a highly specialized, multidisciplinary approach. It usually begins with a pelvic floor physical therapist who actually understands hypermobility.
Which is key.
Yeah, their initial goal isn't handing you a sheet of exercises, it's nervous system regulation. They have to teach diaphragmatic breathing to convince your brain that it is safe to let go of the muscular grip.
Our sources detail a specific technology used in these physical therapy sessions that sounds incredible. Real-time ultrasound biofeedback.
It's a game changer.
How does it help a patient who can't figure out how to relax?
Because a hypermobile patient's brain has been actively ignoring or fighting these muscles for so long, they suffer from terrible sensory awareness. They literally cannot feel the difference between a clenched muscle and a relaxed muscle.
The mind-muscle connection is gone.
Completely. So the therapist will place an ultrasound wand on the perineum or abdomen, and the patient can look at a monitor and visually see the white clouds of their own pelvic floor muscle tissue.
They are watching their own internal muscles function in real time.
Exactly. The therapist guides their breathing, and the patient can watch the screen to see if the muscle is actually dropping and lengthening. It bridges the gap between the brain and the body, allowing them to consciously manipulate a process they previously had no control over.
Which highlights a concept from the sources called proprioception. Proprioception is basically your brain's awareness of where your body parts are in space.
Think about it like this. Imagine trying to type on your computer keyboard with your eyes completely closed.
Sure, most of us can do that.
Right. Now imagine someone has secretly moved all the keys 1 inch to the left. You would be hitting the wrong keys constantly because your brain's map of the keyboard doesn't match physical reality.
Oh, that makes so much sense.
That is what hypermobile proprioception feels like. The brain's internal map is incredibly glitchy. Patients literally do not know the exact position of their pelvis or their joints without physically looking at them.
So treating hypermobility is about fixing that internal map. It's about reteaching the brain where the joints are, optimizing skeletal alignment so the pelvic organs are stacked correctly over the bones, and reducing the mechanical strain on that fragile connective tissue.
Yes, and it requires pacing your daily activities, managing your gut health so you aren't straining and damaging the tissues further, and finding a coordinated care team that looks at the whole picture.
It requires treating the body as an interconnected system, which is honestly how medicine should always operate.
Absolutely.
We started this deep dive with a very specific mission. Can joint hypermobility affect pelvic support tissues? The answer is an overwhelming, absolute yes.
It affects it profoundly.
Faulty collagen undermines the very scaffolding of the pelvis. This triggers that fascinating, painful paradox where loose ligaments cause hyper-tight, exhausted muscles. And that combination leads directly to prolapse, to incontinence, to chronic pain, and to systemic issues that cascade through the digestive and autonomic nervous systems.
The symptoms present across a dozen different medical specialties, but the root cause is the exact same connective tissue blueprint.
So if you or someone you love has a history of being the bendy kid, and you also struggle with easy bruising, mysterious digestive issues, dizzy spells when you stand up, and chronic pelvic pain or leakage, you aren't crazy.
You are making it up.
Not at all. These are all interconnected pieces of the exact same puzzle. Seek out specialists, particularly pelvic floor physical therapists, who specifically understand the mechanics of hypermobility. Your body isn't betraying you randomly. It's just been working incredibly hard to hold you together with the wrong materials.
Having that systemic mechanism explained is often the most validating moment in a patient's entire medical journey.
To leave you with one final provocative thought to mull over, we've established that pelvic floor health is deeply, inextricably dependent on the microscopic collagen woven throughout your entire body.
Wait.
Right now, severe pelvic organ prolapse is often treated with localized surgery, literally cutting and sewing things back up in the pelvis. But if the core issue is systemic, faulty collagen, could the future of treating prolapse bypass the scalpel entirely?
That is a fascinating question.
Could we eventually see systemic therapies that reprogram how our bodies synthesize collagen from the inside out, fixing the cellular bungee cords before they ever have a chance to snap?
That is the ultimate frontier of connective tissue medicine.
It is a mind-bending possibility. Thanks for diving deep with us today.